Hello. This is a quick video, and actually we are going to discuss about a practical difficulty that is commonly faced by people who are practicing bachelor remedies. That is about picking a combination. People who are practicing homeopathy, they know that they are not allowed to make any combination of medicines, but in bachelor therapy, you actually can make combination of up to 7 remedies. That's what Dr. Bach had done. If you know rescue remedy, that's a official combination of 5 remedies. So you can actually mix up to 5 to 6 remedies together for any person, and you can prescribe that combination to that individual patient. The problem arises when each and every statement of the patient or each and every complaint of the patient will indicate a different remedy to you. And towards the end of the case taking, if you have more than 10 remedies or more than 12 remedies, then it becomes too difficult to judge or to select the remedies out of that group of remedies that you have come to. Then the question arises whether we can give 10 remedies together. The question arises whether we can uh, make two combinations of 5 6 remedies in one combination and the other 6 remedies in other combination, and can we give both the combinations together. But then the question will arise, why can't we mix all 38 together and give to the patient? Whichever is applicable will act, whichever is not applicable will not act. But that doesn't work. My practical experience over last 10 15 years is the less amount of or the less number of remedies that you mix, the more effective the combination is. So I prefer mixing not more than 5 or 4 remedies together. If given a choice, I will mix only two remedies or just give one remedy. Now the question arises, when you have 10 remedies that are indicated, that seem to be indicated, then how to choose which remedy or which 3 remedies or which 4 remedies to choose for that combination. Now there are two ways that I personally use. I teach this during my workshops as well. So this is a usual practical tip that I usually discuss during the workshops. The first is, you need to understand what are the primary and the secondary feelings. By primary feelings, we mean that there are always certain emotions and certain states that lead to certain different emotional states and symptoms. Like, for example, I may be quite intolerant and irritable towards a particular person. For example, one of my friends, if I hate that friend, if I literally don't like that friend at all, then whatever he will do, I will be very censorious. I will be very critical. Whatever he will say, I will immediately react to that person. I will criticize each and everything. So I might look like I'm a beach because I'm intolerant. I'm super critical about that person. Whatever he or she says, I will be very angry at very trivial things. So it might seem like I need cherry plum to control my anger toward that person. But these are secondary feeling states. If you understand the primary feeling state, that's the hatred towards that person. Just because I hate that person, anything that the person does becomes intolerant for me. Anything that person does becomes a trigger for my anger or for my reaction. So instead of giving beach and cherry plum, if you give holly to take care of my anger, then that will be a better way of prescribing for my that particular state. Now somebody will ask me, can we give beach, holly, and cherry plum together? Yeah, you can give. Obviously, you can give. But the question is, can we come from 10 remedies to 3 remedies? And if you want to give 3 remedies, then give a priority to the primary feelings rather than the secondary feelings. Because if you take care of the hatred by giving holly, then these cherry plum and beach states will go on their own because they are coming out of that hatred. So once you treat the root cause, the secondary effects will go on their own. That's the first way of dealing with this. Second way of dealing is, if you don't know what are primary and secondary feelings, then what one can do is, you prioritize what feelings or what symptoms you want to treat first. The priority can be given or can be set by the patient, or it can be set by you as a physician. So if the patient is saying, I'm anxious and I feel very fearsome when I travel by air, That is one problem that I'm coming to you. The other problem is I feel very irritated and very angry, and I have a cleanliness mania, and I want to get rid of that. Now there are two things that the patient is coming to you with. You can ask the patient what will you like to treat first. Whether you want your cleanliness mania, which is a day-to-day problem, to be treated first, or your fear of heights or fear of flying. Based on that, you can choose the combination for that particular priority complaint combination. So you can give that combination first. Once those symptoms and that mental states gets resolved, then you can shift to the other one, and you can choose a combination for the other thing. Otherwise, you will come with 10 remedies, and then you will go on mixing. More number of remedies you mix, it's going to be problematic. It's not going to be as effective as the lesser number of. So although Dr. Batch has said that you can mix up to 5 to 7 remedies, I would uh, I would suggest you to stick to hardly 3 to 4 remedies, and that will act better. If you can understand the root core feeling of that person, core problem of that person, and if you can choose just one remedy, that will be the best possible thing. But that's very difficult at times. So 3 to 4 remedies is definitely good. If the patient is not in a position to prioritize, then I, as a physician, can prioritize. I will tell the patient that, okay, this is something that we will treat first. Once you are okay with this, then we'll treat the other complaints of yours. So if you want to reduce the number of remedies from 10, 15 remedies, which seem to be indicated for a particular patient, to 3 or 4 remedies, then you can do either the primary and the secondary feeling states. So you treat the primary, and then you obviously you on their own, or you indirectly you take care of the secondary as well. So either the primary and secondary feelings, or prioritizing the complaints to more priority complaints should be treated first by that particular appropriate combination, and the other priority combinations can be given later on. So this is the most practically and most commonly encountered problem with practice of bachelor remedies, that which remedies and how to select a remedy. We will be coming with a next video where we will be dealing with another practical and common problem of how to select a remedy for yourself, because that's another practical problem that people will face. But wait for that video, and we will meet again after a couple of days with answer to that question, that how to select remedy for your own self. If you want to have more and more regular videos on health, homeopathy, and bachelor remedies, please do check our YouTube channel. Do subscribe to it. Do share this channel and these videos with your friends, and do write in comments what new topics that you want me to cover. Thank you.